Hi guys, my name is Kevin Budashevsky and this is Phenylketonuria. Alright, time for a test question alert. So PKU is one of the most common human enzyme deficiencies with an incidence of 1 in 10,000. Since it's common and important to detect, the USMLE loves to test on phenylketonuria. Make sure you know the mechanism and the amino acids involved for test day. So what causes PKU? Phenylketonuria can either be caused by an autosomal recessive deficiency in phenylalanine hydroxylase, or by the deficiency of the cofactor tetrahydrobiopterin. Both of these are required to convert phenylalanine to tyrosine, so a deficiency in either results in a buildup of phenylalanine, as well as a tyrosine deficiency. The excess phenylalanine can then be converted to phenylketones such as phenylacetate and phenylpyruvate. These phenylketones get spilled to the urine, and hence the clever name phenylketonuria. Tyrosine then becomes an essential amino acid, since phenylalanine does not get converted to tyrosine, and if it's not consumed enough in the diet, catecholamines cannot get produced. Thinking back to our discussion of catecholamine synthesis, phenylalanine is converted to tyrosine, which can be converted into the catecholamines. Also, without tyrosine, you cannot produce thyroxine or melanin. Consequently, patients with PKU will have intellectual disability, growth retardation, lack of thyroxine, seizures, as well as fair skin due to lack of melanin. They will also have eczema and a musty body odor, which is caused by excess phenylketones. To remember this connection, keep in mind that the phenyl group is a functional aromatic ring, and patients with this disease will have a distinctive aroma. So what else in this pathway would be on your differential diagnosis if you saw fair skin but did not have any other symptoms? So recall that albinism is due to a deficiency in tyrosinase, affecting the synthesis of melanin shown here. If you see the words musty odor on test day, immediately think of phenylketonuria though. If a patient is diagnosed with PKU, how do you treat this disorder? So the treatment of PKU is to eat less phenylalanine and eat more tyrosine. Since artificial sweeteners such as aspartame and NutraSweet contain phenylalanine, patients with PKU should avoid these. If you have a soda can in front of you, check out the label. Most soda cans will say something along the lines of phenylketonurics contains phenylalanine. PKU can also arise in a fetus if the mother does not have sufficient dietary intake of aromatic amino acids. Infants from these mothers have microcephaly, mental and growth retardation, as well as congenital heart defects. You will see the same congenital defects if the mother has PKU and does not adhere to her dietary restrictions, since phenylalanine and its phenylketones can cross the placenta. Newborns are often screened for the disease 2 to 3 days after birth, and the reason it isn't immediately checked for is because some of the maternal phenylalanine hydroxylase may be in fetal circulation during the first few days. Alright, time for a flash quiz. So a 3-day-old infant has elevated urine phenylacetate as well as phenylpyruvate. What are two possible defects? So this question is asking what defects cause phenylketones to accumulate. The first defect could be due to a missing enzyme, which would be phenylalanine hydroxylase, but remember that this also requires a cofactor, tetrahydrobiopterin, or THB. If either of these two are missing, phenylalanine cannot be converted to tyrosine or any of its derivatives.